What happens when your brain fills visual gaps in a visual field test? Imagine looking at a scene and suddenly noticing a small blind spot or missing patch in your vision. During a visual field test, your brain often fills in these gaps, making your vision seem complete even when parts are actually missing. This isn't just a trick. It's a normal part of how your brain processes what you see. When you undergo a visual field test, which is a common eye examination used to detect issues like glaucoma or macular degeneration, you're asked to focus on a central point while lights or shapes appear in your peripheral vision. You press a button whenever you see these stimuli. Sometimes, especially if you have a blind spot or a scotoma, your brain fills in the missing parts, so you might not notice the gap at all. This process is called perceptual filling in. It's a natural function of the visual system that helps us interpret our surroundings smoothly. For example, if you have a blind spot caused by the optic nerve exiting the retina, your brain uses information from the surrounding area to fill in that space with the background color or texture. This is why most people are unaware of their blind spots in everyday life. The brain's ability to fill in missing information involves activity in the early visual areas of the brain, such as the primary visual cortex and secondary visual areas. These regions become active even when no actual visual input is present in the gap, showing that the brain is actively constructing what we see based on surrounding cues. Neuroscientific studies have shown that filling in involves complex neural mechanisms. It can be influenced by motion, color, and texture, with different neural pathways involved for each attribute. This process helps us perceive a continuous, stable visual world, even when parts of our visual input are missing or obstructed. However, this remarkable ability can sometimes mask early signs of eye disease. In conditions like glaucoma or macular degeneration, the brain's filling in can hide the presence of blind spots or areas of reduced vision, making it harder for patients to notice symptoms and delaying diagnosis. This is why regular eye exams that include visual field testing are so important. These tests are designed to detect even small gaps in the visual field that the brain might be filling in. By using precise and standardized methods, eye care professionals can identify areas of actual vision loss that might otherwise go unnoticed. Detecting these early signs allows for timely intervention, which can slow or prevent further damage in diseases like glaucoma or macular degeneration. It's crucial to understand that filling in does not repair the damage to the eye or optic nerve. It's simply the brain's way of compensating for missing information. Relying solely on this process can be risky because it might lead to delayed diagnosis of serious eye conditions. If you notice any changes in your vision or experience new blind spots, it's essential to seek professional evaluation. Remember, each person's eye health is unique, and only a qualified care provider can give personalized advice and appropriate testing. In summary, when your brain fills visual gaps during a visual field test, it's actively creating a seamless picture based on surrounding information. While this helps us navigate the world effortlessly, it can also hide early signs of eye disease. That's why regular examinations are vital for maintaining health and catching conditions like glaucoma and macular degeneration early. Always consult with an eye care professional for personalized assessment and guidance to protect your vision for years to come.